This lesson will focus on pupillometry, one of the 4 new measurements in the LENSTAR system. For the surgeon, the pupil diameter measurement is a significant addition to premium IOL data, and with LENSTAR's advanced technology, pupil diameter is measured instantly, along with 8 other measurements. This exclusive LENSTAR feature eliminates a separate and time-consuming pupillometry measurement exam. At the conclusion of the LENSTAR scan, a digital image of the eye is taken, and the diameter of the pupil is provided, and just like the other LENSTAR measurements, can be reviewed and adjusted if necessary for quality.
And now we'll look at the pupil diameter. And once again, we can change the size, change the position.
Pupil diameter in ambient light condition is a crucial preoperative measurement in the candidate selection process for premium IOLs. Other biometers do not measure pupillometry. This forces surgeons who use this information to conduct a separate examination. The LENSTAR cuts the time-consuming examinations and completes the measurement in seconds. Dr. Uday Devgan reports that pupil size affects vision with any IOL, but even more so with multifocal lenses. Multifocal IOLs limit diffractive rings to the central zone of the optic. Some multifocal IOLs have diffractive rings through the entire optic, resulting in improved reading vision in low light situations when pupil sizes are larger.
If a patient has a very large pupil, 5mm pupil, this patient's eye is going to be distance dominant, and they're going to have a tough time reading even with that diffractive lens. Whereas if a patient has a smaller pupil, 3mm or so, in normal conditions, that patient will be able to get the full even split of light for near and far with this lens. So certainly we've learned that multifocal lenses that have these zones do need to have a certain pupil size for optimal function. Other thing I use too is even pupil centration. And the reason why that's important is that a couple things. One, I actually like to put multifocal lenses very well centered in the pupil.
In the pupil?
In the pupil, not the capsular bag. So you can measure this ahead of time and say, look, this patient actually has a pupil that's decentered. The barycenter is off by a millimeter, millimeter and a half, etc. And then on the OR table, you'll know that, well, I should shift this lens a little nasally. You can also try to have the patient fix it on your scope light. But the closer you get a multifocal lens to be centered up in the pupil, I think the better your visual results are going to be.
Dr. Jeff Horn states that knowing pupil diameter is very important in IOL selection, and especially helpful in determining IOL selection for aspheric, accommodating, and diffractive multifocal IOLs.
If you have a patient with a very large photopic pupil, I'll show you why the Restore may not work as well. And you need to know that. The Technis multifocal is a full optic diffractive. All of the light is diffracted regardless of what part of the lens it passes through, and all of the light is split equally, 50-50, regardless of the size of the aperture. Most people have smaller pupils as they get older, but not everybody. And there are outliers, and that's where the LENSTAR can help.
Pupillometry is essential for premium IOL selection. LENSTAR offers you expediency with this key measurement conducted instantly and accurately, along with 8 other measurements. This new and very important measurement has never been captured before with optical biometry. It's measured instantly, painlessly, and accurately, giving you full control of the data electronically. If you want no compromises, perfect outcomes with premium IOLs, LENSTAR will give you the edge. Call 888-MY-LENSTAR or visit myLENSTAR.com to learn more or to arrange a demonstration of LENSTAR so you can see for yourself how LENSTAR can provide immediate value in your practice.